Good morning. Dr. Sampa Chitambalotunu. I'm the acting director at the National Malaria Elimination Center, which is the center that has been targeted with the task to eliminate malaria in Zambia. Malaria in Zambia is a serious public health problem. A lot of strides have been made over the years. We sort of went into a plateau, but then we saw in 2023, which was last year, an increase in the number of cases. The previous year, 2022, we had 8.1 million cases across the country, and we saw it increase to 11.1 million cases. This is a huge challenge, and this now coincided with the time that we did a mass net distribution of 11.6 million nets. We hope that we're able to see the impact of that mass net distribution. Therefore, as the National Malaria Elimination Center, which is part of the Ministry of Health, really appreciate Immunify Life reaching out to Zambia, selecting Zambia as a place where their software could be utilized. We really appreciate that. We see the importance not only of the 400 nets that are being distributed by Immunify Life, which would save lives, protect people from malaria. And when someone doesn't have malaria, it will mean that you're not disturbing their earning as a family, because it doesn't only affect health, it also affects the economy, the earning power of that family. I really think malaria can be ended. In fact, as Zambia, we hope to eliminate malaria together with the rest of the region by the year 2030. Therefore, it's very important to have a software like this one being offered to Zambia through this pilot which has started. Because of interventions, we've seen that even though the cases increased, we've had 5 of the 10 provinces in Zambia where we saw a decrease in the number of deaths. I think I did not mention the number of deaths due to malaria also increased from 1,300 somewhere there in 2022 to above 1,600. So we can see that the malaria situation is quite serious. When you have a situation like this one, where the number of cases have increased, where the problem of malaria is really become very serious, the importance of data cannot be overemphasized. As you know, with data, correct data will imply that you make the right decision. Timely data means that you make the decision at the right time. Right now, as Zambia, the Zambian government has invested huge resources into data systems, but unfortunately, most of these data systems do not have the real-time aspect of it. Since they don't have the real-time aspect, implies that, for instance, we might be saying, we want to know what is the malaria situation, how many cases did we have in such and such a district, such and such a province. Then you find that you're looking at data that is 1 month old or so. And that doesn't allow for one to make timely decision. It's also important, like now we have distributed 11.6 million nets. We want to know the impact of these nets. What impact has these nets done? And the earlier you know, for instance, if we're able to know in a timely manner how the nets are being used, if they are not being used correctly, if we know now, timely, it means we're able to make decisions now than waiting at the end of the year when you sum up all data, and maybe by the time you receive the whole year's data, you're not even receiving it in December, but you're receiving it maybe a month or 2 months later. So very important. We really appreciate the Immunify Life software, not only because it is simple, meaning that it is user-friendly, but the fact that this software has the real-time aspect. The real-time aspect has really excited us, and we look forward to seeing how more we can use this tool to really tailor it to the Zambian situation and take advantage of this real-time aspect of the software. so that we see how we impact malaria in a timely manner, in an effective way. And I'd like to end by saying we really thank Immunify Life and the founder Guy for really traveling all those hours. Is it 30 hours to Zambia? And really come and stay in a rural place, Chongwe, sleep there. And I say, we're not taking this for granted. Thank you very much.